So today's topic for discussion is Candida. So before jumping into the topic, we need to understand the different fungus classification of fungi. So there are certain different classification of fungi. So first is the morphological classification. So morphological classification, first is your yeast, then second is your yeast-like organism, then third is your mold, and the fourth is your dimorphic fungi. So what do you understand by yeast, yeast-like, mold, and dimorphic fungi? So yeast are your round, oval, budding cells. Okay, they don't have pseudohyphae. So the important example of the yeast are Cryptococcus neoformans and Saccharomyces. But in your clinical aspect, Cryptococcus neoformans are very important. They are mostly associated with HIV patients and they cause meningitis-like symptoms. Then your yeast-like, where Candida resides. Yeast-like means they produce these budding yeast cells, but at the same time they will have this pseudohyphae. They don't have true hyphae. Okay, so the important example is Candida. Then your moths. They are sometimes branched, sometimes aseptate. Okay, so these are long one, and the most important example of your molds are, first is your rhizopus, the mucor, which in the COVID duration we call it as a black fungus, and second is your aspergillus. Okay, and third is the dermatophytes. Most of the skin lesions, when you are doing your dermat ward OPD, then there you will find all these kind of infection. Okay. Now fourth is the dimorphic fungi. They have a certain peculiar feature about this fungus. What feature? At 37 degrees centigrade, they will function as a yeast, and 25 degrees centigrade, they will work as a mold. Means when 37 degrees centigrade is mostly your body temperature. So when they are inside your body will work as an incubator and they will convert it into yeast. And when they are in the room temperature, they convert it into molds. So important example of all these fungi are, first is the histoplasma, very important according to the Indian scenario. Then your penicillium. Third is the blastomyces. Fourth, coccidioides and paracoccoides. Okay. Then this is again the crest of your classification which I told you. So what is the classification? First, if you look at the yeast, there are two type of yeast. First is the true and the second is the yeast-like. So we call it as a, they have pseudohyphae, and the important example is Candida. Then the mold. Molds are what? They mostly are aseptate and they could be also septate. In the septate hyphae, the important examples are Aspergillus, Penicillium, and these three are your dermatophytes. And aseptate, the most important example is Rhizopus and Mucor. Okay. Then dimorphic fungi, 37 degrees centigrade, they will function as a yeast, and at 25 degrees centigrade, they function as a mold. An important example I have told you, and the important examples are histoplasma, blastomyces, paracoccidioides. Okay. Then look at the picture. This is the picture of your true hyphae. The most important thing is when you look at that, these are the hyphae, and they don't have constrict. They don't have proper big hyphae. What they have, what is the important aspect is they have constriction. Means these hyphae will go and diverge at a point. They will have constriction like this. Okay. So whenever there is a constriction, new branch will arise from that constriction. So this is the characteristic feature of your pseudohyphae. When you look at these two hyphae, these are aseptate true hyphae. They don't have any constriction. Then these are your septate branched hyphae. Okay, and these are mostly your aspergillus, and these are mostly your mucor. Then look at these. These are your budding yeast cells. No hyphae, no pseudohyphae, nothing. True yeast, only budding yeast cells. So mostly you will see these kind of picture in Cryptococcus neoformans. So this is the basic difference between pseudohyphae and the true hyphae. When you look at the septals are like in the pseudohyphae there are constriction, in the true hyphae there is no constriction, and the important thing is like in the true hyphae they have apical elongation. Okay. So now this is the fungal classification according to diseases. Okay, fine. So fungus, what do you understand by the fungus? There are certain classification of the fungus. So first of all, there are some superficial mycosis, means those mycosis, those fungus which are present on your skin, which cause infection of your skin. So they will affect your skin, hair, nails, and the important example are tinea versicolor, tinea nigra, dermatophytes. All these are the common example. Then subcutaneous mycosis means they will involve your skin also, they can involve your mucous membrane also, they can involve your dermis, they can also involve your subcutaneous tissues. So the important example are mycetomas, chromoblastomycosis, sporotrichosis. These three are very important for your NIT and INI exams. Then third is the systemic mycosis, means now they are going deeper and they will involve your blood vessels, and then they will involve your different tissues like systemic mycosis. They affect your lung and they spread to the different organ. The important examples are histoplasmosis, blastomycosis, coccidioides, and then paracoccidiomycosis. Okay. Now fourth is your opportunistic mycosis. The opportunistic mycosis means they are available, they are effective when your immune system is weak. Means you are immunocompromised like HIV patients. When the patient is in ICU ward for so long, they are having antibiotics for so long, they having some connective tissue disorder, their immunities are weak, or the patient is on corticosteroid for so long, steroidal things for so long. So the opportunistic mycosis are candida. The topic of the discussion is present in your opportunistic mycosis because this candida are present inside your body in your mouth as a commensal. Okay, but still when your immunity is weak, they can present with the symptoms associated with this candida. Then the other examples are cryptococcus, your aspergillosis, then zygomycosis means your mucorenol, and the penicilliosis in the HIV patient. Then there is a certain class of fungal disease which we call it as a mycotoxicosis. This is an important one. Sometimes the examiner could ask questions on this, but this is very important for your university PG and UG exam. So these toxicosis is due to the toxin mediation. Now, these are your certain images showing your subcutaneous mycosis and superficial mycosis. Look at these fingers. These are caused due to the needle prick and mostly it could be due to your sporotrichosis. Then look at these cauliflower-like lesions. Okay, these cauliflower-like lesions are due to what? Chromoblastomycosis. Then the superficial lesions. Okay, these are due to your dermatophytes or tinea infections. Okay, then this is your mycetomas. The important feature of mycetomas is what they have, these sinuses, draining sinuses. So that's all for the today's discussion, and I will be taking the different class in my different lectures. So thank you.